Who is that?
Nine.
Nine?
Lion. Oh, yeah. Oh! He's cool. Is that your purse? Very cute. Do you put line in there? Is it right in there?
Yeah.
Cute. I'm Tim Newhook. You probably figured out I'm a liver surgeon.
Yeah.
That's all I do. Is look at pictures of liver, decide when surgery makes sense, direct traffic to things that may be better than surgery. I just look at pictures of liver all day long. About 80-90% of what I do is metastatic colorectal cancer to the liver, which is what this seems to be. Okay.
What is that?
I'm sorry, Sam.
Repeat it again. What did you say?
I said about 80 or 90% of what I do is taking care of patients with metastatic colorectal cancer, which is cancer that travels from the colon or the rectum to the liver and takes up shop. Does that make sense?
Oh, okay.
Yeah.
Okay, so it traveled up there. It just
Probably, yeah. I know the story and I've heard everything from Deb, but let me show you what I think's going on, okay? And I'm a terrible artist, so we got a cheat sheet.
Okay.
This is you, like that, okay? So this is your right side, this is your left side. Feet, and this is towards your head, because here's where your heart lives, okay? And this is a three-dimensional structure, so we don't have this dimension, okay?
Okay.
Your liver is the largest solid organ in your body. It lives between your right nipple and your ribs, around the middle, all the way around to your back. So it's just this massive space. It's just all liver, okay? And it's like a tree or a broccoli. It has a stalk or a trunk. And that's where the traffic comes in and out of the liver, okay? And all the blood that comes to your liver, for the most part, comes through this tube called the portal vein. And this vein comes into the liver and then it branches out like a tree. The tree branches all over the place, okay? And when it's out in the periphery, the liver filters that blood and then gets the stuff that it doesn't like out and puts it into a liquid called bile. And then that bile comes out of the liver through the gut. Okay. The blood that is filtered then goes back to the heart. That blood that is being filtered by the liver is blood from your intestines and colon. So all the blood trying to get back to your heart from your intestines and colon must go through the liver first. So it's like a big pool filter. Does that make sense? So that's why it's the most common site of metastasis, which means the cancer spreading from all cancers in the belly like that. So colon or rectal cancer can go to the liver because it gets in the blood and it gets trapped in the pool filter. Does that make sense?
Yeah.
So that's what I think is going on here, okay? I see a single tumor that is over here on the right side of your liver, okay? So I see a single tumor. It was not there before, okay? In right liver. I think this is a metastasis.
Did we just have one liver or two?
Excuse me, you have one liver.
One liver.
Well, you have one, yes, one liver. That's the right, there's more to it than that, but yes, one liver.
Oh, okay.
Yeah. Technically, your right and your left liver are separate, but it's one organ.
One,
Yeah,
okay.
yeah, so the nerdy answer would have been two. You know what I mean? But this tumor here was not on any of your imaging beforehand and is now visible, and it looks like a cancer. And it's most likely, we don't even biopsy it, most likely metastasis from your other cancer. That was removed, okay? And it's not necessarily that there's still a cancer in your pelvis that is going to your liver. It was there from the very beginning, but it was microscopic.
Okay, baby.
Can't see it. The CT scans are just a camera, they're not a microscope, right? So the cancer that they removed from your pelvis, the rectal cancer, was an aggressive cancer. When they looked under the microscope, it had some features of it that are associated with distant travel, if that makes sense. So that's why we watch after surgery getting pictures, because we're concerned that maybe it would come back. And I think it has in your liver. Okay. So the question is what to do about that now. Okay. This is metastatic rectal cancer.
What is that word?
I'm gonna yell.
Okay.
I'll explain it for you 1 second. I'm just trying to write all these notes so you can take this sheet. Okay. So metastatic rectal cancer. So I put metastasis in parentheses here. What that means is, let me draw another arrow here, is it's rectal cancer to the liver. A metastasis means that it's a distant spread of the cancer from your rectum. So that makes this stage 4 cancer. Okay. I don't know if Dr. Ludford told you that. Did she tell you that or anything? Yeah. So this is stage 4 cancer. The truth is that stage 4 cancer sounds very scary, right? I understand. That's the highest stage, but that doesn't mean we can't do something about it. If you can imagine this example, there can be a single cell, microscopic, one tiny, tiny little pinpoint tumor that's outside your rectum somewhere in your body. That's stage 4, because the rectum cancer somewhere else. Or you could have a tumor the size of Texas, or tumors all over your body, also stage 4. So there's a huge spectrum based on how much cancer has traveled elsewhere. Does that make sense? So this is a very low burden of disease, we would say. It's a small amount.
Very little.
Yeah, there's one tumor that I can see in your liver, right?
Tell them she's not going to die. She's
Well,
going to see.
I don't want that to happen for you either,
No.
right? And there is still a chance that this can be treated and it would never come back.
All right.
Or there's a chance we treat this and it does come back, but then we treat it again.
Yeah.
But the point is that this episode is treatable.
Thank you.
Okay, does that make sense? So the options to treat this tumor, there are a few. But right now, given its size and where it is, I would recommend surgery. Okay? And to do that, we would remove it just like this. Removing a small piece of your liver containing that tumor. I will tell you that I think that it would be helpful to get chemotherapy again.
Mommy.
Okay? Because this is just a clue.
Mommy.
This is a clue that maybe there's other stuff we can't see. It could be. I don't know. But what I do know is that people who do get these tumors removed, 80% of people have another recurrence. So that means 80% of people have a disease we couldn't see, right? So for that reason, we usually start with chemo to try to get your foot on the brake. Does that make sense? Yeah. After a couple months of chemo, this may get smaller. In fact, it likely will. And if this got much smaller, it could probably be treated with something other than surgery that's a lot more tolerable. A lot more tolerable. Like heat.
Oh, yeah.
Ablation, So I think chemo would make sense for 2 reasons. 1, so we have the disease under control, but also number 2, because if this got smaller, it may be able to give you an option that's better to recover from than surgery, that is equivalent with outcomes. See what I'm saying?
Yeah.
So I would start with chemo personally and just see what happens.
Okay.
So I'm going to write that here for you, okay? So recommend starting with chemotherapy. And Dr. Ludford, I've already been talking to her and I'll talk to her again, because this may make tumor smaller.
But, Mommy.
And
Where's my Sparky?
ablation
Where's my Sparky,
versus
Mommy?
I put them in the bag.
surgery.
Real.
In here.
Okay?
Put your hand in here.
So if this thing got much smaller, that's what I would do for myself. So surgery is surgery. You would be fine. You would recover fine. not a problem. I'm not going to remove a lot of your liver. You'll be fine. But it's a surgery, right?
Yeah.
Ablation is almost like it's like a same-day procedure.
Yeah, that would be better.
Of course, yeah. As it stands right now, the way it looks and its size, I would recommend surgery over ablation. But with some chemo, it might get to ablation.
Okay.
See
And
what I
what are
mean?
like the chances?
Pretty good, actually. I think you need chemo anyways, just because it's come back,
Yeah.
right? So let's just see what happens with some chemo, and if it gets smaller, then I'll set you up for that rather than surgery. But if I still think surgery is the best option for you, I'll tell you.
Okay.
But this is something we can treat and move on and see. But then we just have to keep following closely in case it comes back again. Okay.
So, because I got confused on the words curable, no, not curable, but treatable.
That's
So-
a very good question.
So what is that?
And I'll throw in another term that is a little bit even more confusing. Curative intent. And that's the term I use.
Mm-hmm.
Treating this tumor is with curative intent, which means you don't have cancer elsewhere in your body, and my hope is that we do something for this such that it never comes back.
Okay.
But surgery or anything like it, ablation or whatever, is only acting on cancer we can see. What we can't control is the chance for cancer we can't see, right? So even though I'm treating this thing and now you don't have anything on your scans or whatever, there's still a risk that it could come back. Now,
Somewhere
exactly, or in the liver again, and we do the whole same thing all over again, right? But being curable means that this gets treated and it really honestly doesn't ever come back. And so in 5 years, 10 years, it hasn't come back, that's where you can use the word cure. Is this curable? Potentially,
Okay.
but only time will tell. The treatment of this is with curative intent. My intent is to take this off the table for you and that I hope it never comes back, but we don't have that control. If that makes sense. So,
Makes sense.
there are things that are associated with a better chance of it never coming back, and one of them is the fact that you only have one tumor. If you had 10 of them, we'd still be talking the same thing. We would give some chemo and maybe try to go to surgery. But you can imagine someone with 10 tumors has a much higher risk of having disease we can't see than someone with one. Does that make sense? It's a target-rich environment, right?
Yeah. Makes sense.
So I think chemo, because it came back, but also to make it smaller and maybe help you help you with your recovery, be easier to take care of her. That's got to be a lot of work because I know. Yeah.
Mom does it.
Yeah, I understand. It's a lot, but you know what I mean.
Okay.
Thank you,
Makes
doctor.
sense.
Yeah.
What questions do you have? You'll
You-
have more.
You
Just call
sure?
me.
Yeah.
I know you have more.
I'll have
You
one
just,
later.
yeah, just call me, okay?
Okay.
But this is for you to take. And I'll draw for you again, I'm sure. But, because I always. But the call numbers are on here. Deb's number's on here. Are on here. Although I'm very rarely at those numbers. They're my academic office. I'm either here or in the operating room. But just try to reach out if you have questions.
Dile de la aseguranza, mamá.
So who can I talk to about insurance?
Yes. That would not be me.
Okay. Is there numbers I can?
Yeah, yes, we can help you with that for sure. I have never asked anyone about their insurance, so I don't even know how to answer that. But you mean in terms of having help with insurance, or
because
about
the insurance I had, it only let me upgrade it for the treatment for 1 year. So I already did the whole treatment. The surgery covered it for the whole year.
Yeah.
But now it's the next year, and they said, well, I still have to call them, but they said it was just like a one-time upgrade. So I don't know if there's like another insurance I could pay so they
Okay.
can help with the treatments.
Yeah. Okay.
Or do y'all offer like plans or?
I have no idea.
Yeah. So if you can give me some numbers,
Yes.
maybe to ask.
So let me ask my nurse whether that would be. So our social work department is the ones who they know everything. They can help direct. They know your insurance. They'll help direct your insurance. Then we also have the financial office
Okay.
as well. They're both kind of the same thing. But
Okay.
let me get that number for you
Yeah.
and ask them to talk to you, reach out to you about just making sure that this is all going to be okay.
Okay.
And if it's not,
Like a dog.
you call me and I'll help you find somewhere or
Okay.
someone personally. I will help you so you get the best care. Okay?
Thank you.
Okay, perfect.
Because this is something that can be treated.
Okay,
Okay.
Call me. Okay?
I will.
All right, hang tight. I'm gonna have her bring that number for you.
Thank you,
It's nice
doctor.
to meet you.
Thank you.
Okay, keep moving. Okay.
Thank you,
It's nice
doctor.
to meet you.
It was a
My
pleasure.
Bye, dear. Bye, sweetie.
Bye.
Bye, dear. Bye, bye. See ya. Hang tight 1 second.
Okay.